Born and raised here in Shreveport, actually, Shreveport, Bossier, and I did most of my schooling around here, and then when I made the decision to become a physician, I went off to Chicago to Rosalind Franklin University, where I did my graduate medical education. And the third and fourth year of that was clinical rotation, so we go coast to coast, or very nearly coast to coast. I did clinical rotations from Phoenix and Denver all the way to Atlanta, Miami, Texas. So I had the opportunity to really work with a lot of very good surgeons and see a lot of different ways of doing things. And then I matched for my residency in Fort Worth, Texas at John Peter Smith Hospital. And again, that was another great opportunity to work with some outstanding surgeons, both podiatric foot and ankle surgeons and orthopedic surgeons. My wife and I in 2016 moved back home to Shreveport, where I was in practice for a few years before being given the opportunity to join Bossier Orthopedics in the Willis Knighton family. It's a field that's evolving very quickly. There's a lot of development in foot and ankle. We get new technologies and techniques coming out literally every year. So being on the cutting edge of a field that was changing so quickly intrigued me. The other interesting thing about foot and ankle surgery to me is how nuanced it is. So the foot and ankle is very complex. There's 26 bones, 33 joints in the foot and ankle, over 100 muscles, tendons, and ligaments. And so you're presented often some very complicated puzzles to solve. But it makes it all the more rewarding when you can come up with a creative solution for your patient, either conservatively or surgically, to help address their problem. The people, plain and simple. For all of the shiny buildings and equipment that Willis Knighton has, and don't get me wrong, those things are great and they often help us treat patients better, but what makes Willis Knighton different is what makes any great enterprise different, and that's the people that work there. In practice, I've come to Willis Knighton to operate. I've been a patient at Willis Knighton. My wife had our son at Willis Knighton, and now I've gone through the process of becoming a Willis Knighton network physician. And the one constant throughout all of those experiences has been that the people are just outstanding, and the commitment to do things the right way to the highest standard is always there. Really, all foot and ankle surgery interests me. By going through the training programs that we do, we start to focus on the foot and ankle specifically at a very early stage, and that gives you kind of a head start and an opportunity to sink your teeth into all the different disciplines of foot and ankle surgery. So whether we're talking about sports medicine and arthroscopy, or trauma and reconstructive surgery, joint replacement, deformity correction, all these things are very appealing to me, and I enjoy being on the cutting edge of those disciplines. What makes me enjoy going to work is the tangible difference you can make with your patients. So they come in with a problem, and you may not be able to fix it in one day, and it may be actually a drawn out process, but you can usually fix the problem, as opposed to just saying, I'm sorry, that we've done all we can do. I'm a persistent person, and as long as you stay persistent, you can usually get to a place where people are happy.